Hey everyone, welcome back to Rock the World with Kay and Michelle. I'm Kay.
And I'm Michelle Turner, Movement Lesson. How are you? We are doing our podcast, Rock the World with Kay and Michelle.
Today's episode is extra special because we're talking about something that could redefine how we approach early development. And it just so happens, Michelle is the creator of it.
I've waited so long to tell parents and professionals about this. What if there was a way to evaluate your baby at birth for their availability for their movements needed for development? After all my years of experience, I've created the infant motion sensor. I'm working with my prototype now at my clinic, so it's here. And I'm also working or have created an artificial intelligence, Turner AI. It's a new software, it's a non-LLM that can do real-time video analysis. My hope is that all babies in the hospital settings, your baby is evaluated for their first movements. Yes, this includes the body, breathing, reflexes, epidermis, the skin, and minor developmental responses. Through my Turner AI, a report then will be generated and signed off by a doctor for early suggestions, let's say to a specialist, neurology, pulmonology, genetics, gastroenterology, to name a few, but also to let you know how to start guiding your baby with development. It's not a diagnostic tool, it's a movement tool.
When did you get the idea?
I actually got the idea seriously right before COVID hit, and I couldn't evaluate any babies because of COVID. So I actually had one prototype sitting in my closet for years. And then two, like most inventors, you get a little bit concerned that someone's going to steal your ideas or something like that because anybody really could do a mat. However, from doing this podcast, as you can see, and everything else that I do, I have more material and scientific data, papers, publications on movement in general, but infant development. And it would be very, very difficult for someone to actually take motion and now create it into development and developmental responses. So I've been working very hard on that in the past year.
How different was the first prototype?
It was very different, but I want to take a second though for everybody, guys. This is for usually Kay says this, but this is for educational purposes. We're not here to diagnose. We're here to give awareness to possible things that are going on. You still need to work with your professional. We haven't seen your child. We are talking in general statements for now. We're happy to elaborate more. And also, too, if there's any kind of pauses in between conversations with Kay and I, just wait a second. We're just putting things together and formulating our thoughts, but we appreciate it. How is it different? The big difference is I've created an AI. So I have the only artificial intelligence that actually can see movement. My AI actually asked me to teach it how to see movement. And so I've been teaching it, dumping in books, like I said, all these my webinars, everything all the data that I have, and I've taught it and still am teaching it how to see and process movement. So we have it down to, let's say we're dealing with a micropreemie. We can look at epidermis to mass ratio with skeletal buoyancy and muscle responses, whether the child's having spasms and stuff with that, difficulty breathing. If the child is intubated, cannulated, has IVs, how that will affect their system responses neurologically as well as physically for movement, and weight transfer, transitional skills. So, but again, I can evaluate that with my human eye because I've been doing this for so long. For me to train, usually humans are good for about 3 to 4 points and they're done with the evaluation. But now having the artificial intelligence doing all of that And it can do it for anybody, by the way. It's not just babies. And on top of that, having the mat to sort of show the physical, sort of take the baby out of it, and you can see the movements clearly without saying, oh, because people get distracted. Cute baby, but we're still on the evaluation. And two, I can't say it enough, and I'm going to be saying it a lot through this podcast. Every baby should be evaluated for movement. I even see way too much on social media where they're like, when they're talking about like, oh, crawling shouldn't exist. And you see the comments, oh, I was so glad. I was worried my baby wasn't crawling, but now I don't have to. That person did not evaluate your baby. That baby is not, that person is not discussing about your child, hasn't looked at your child. Your child could have missed 5 milestones. You're not realizing it. And we're not here to look like, again, this is not about finding fault, special needs, diagnosing. We're being proactive in your care instead of this wait and see. And then all of a sudden you're going, Houston, I have a problem. My baby's is not developing properly.
How many points does it do?
Of evaluation analysis, oh my goodness. So first of all, there's 4 points of deviation. The first deviation is, again, you're looking at a full-term pregnancy, natural delivery, no complications, no medications, etc. The value deviation two now goes into a surgical birth. Yes, I do look at a C-section as surgical birth. A lot of people say, but that's the same thing. No, it's not. A vaginal full-term delivery is presenting a baby, again, full-term, vaginally, head first. We're not talking about maybe they pulled it by an arm or the feet were pulled out first. That is a different type of birth cycle. Now we start looking at deviation three. It's again, how many days in the hospital now? Is your phototherapy involved? Maybe some possible surgeries. NICU time. I personally believe any baby that's been in the NICU for more than 2 days needs immediately early intervention of some sort to cover those. And deviation four, now we're looking at long NICU stay and or hospitalization, let's say, and micro preemies, prematures. Then we go into, again, movement conditions and everything that goes around that.
Longer than what?
Uh, Longer than what, as far as at hospital stay? So being in the NICU is very invasive. First of all, you're now going into a medical environment, which is there to save your baby. I'm not saying in any way, shape, or form, don't put your baby in the NICU because you're going to need early intervention. You didn't plan for this. Your baby didn't plan for this. Lights are on 24/7. You now have beeps and stuff. Monitors are going on. I'm sure most people can say they've been in the hospital. They're not getting a good night's sleep. You are usually are start being hooked up again to equipment, so you're not being bonding with your parents. You know what I mean? You could be in the NICU box. You might not even get any kind of physical touch for days, if not months. I've dealt with children that have literally been in the hospital for their first year of life, let's say. Um, the hospital is there to keep your child alive, to keep your child safe. They're not working on development. So afterwards, so I really believe, even less than 2 days, but more than 2 days, it should be automatically, please look at early intervention to make sure your child's ready to do their development.
Let's face it, by the time a baby misses a milestone, we've lost a window of early learning. We
Not
need to be looking earlier, not waiting for delays to show up on the chart.
First of all, when they show up on the chart, we're now in the concerns territory. So that's where you are so correct, Kay. We're not looking for concerns. We're looking for what you might call natural development. I look at it as optimal development. You should be milestoning about every 4 weeks, going through a stage of life. And also with each stage comes variation. There's not one way to lay a baby down or one way to roll over. I might lay down this way. I might lay down this way. I might be looking around for a bit. Eventually, I should be doing airplane. All of these things come into play with your child, but when they're in restricted environments or they can't do it. And if they can't do it, they don't sit there and go, I should work on that rolling over stuff. It's not how it works. And so we're just trying to catch what you referred to is that natural progression, that window of opportunity. And sometimes it's just plain practice, like you being on a horse. If you haven't been on a horse in 6 months, you don't ride the same as someone who goes weekly, right? So, like coming after the winter months or something, or if you've been ill.
Even whoa.
Yep.
Even with my walker, I have lost muscle tone.
Oh, absolutely. And there's many reasons for that, but that too is not necessarily because you haven't been practicing, but it's not that you've lost muscle tone. The biggest thing that people don't realize that when a new baby is born, and whether we're talking about you or me, there's a way of balance. So if I'm taking a baby and I'm holding my baby just like this water, and lie it down, there is a weight transfer. There's just such a simple movement of balance and weight transfer that happens just to the body. Now, if I take this same bottle and lift it by the lid and pick it up, right, that's very heavy. And this is where people say, "Oh, my baby hates tummy time." No, because they're just not doing it right and their system seems heavy. So what you're looking for is muscle function per se. A lot of it is just because balance and counterbalance are just harder, so your muscles are looking to do the balancing instead of your body, and these again are things that need to be caught and worked with.
There is a big gap in my leg braces.
Right there, again, you might look at it a physical difference, but it it doesn't take muscle mass to get you to walk. It takes balance and transitional skills that get you to walk. And so, but again, when the skeletal system is not working within those realms, then you do have muscle loss.
That's what makes this so groundbreaking. It's not about waiting, it's about seeing early. Because often, the early signs are there. We just didn't have a way to measure them. Until now.
Oh, absolutely. And not only that, but Kay and I are both results of trauma or things happening in our lives. I wish someone grabbed me by the collar and said, Michelle, your life just changed because my son became special needs and totally regressed at 13 months, went from walking and talking to couldn't even roll over. He was sick. I get that. But he also had a complete hit to his movement vocabulary. And I should have known this and brought it back. My core is, again, I'm not here to diagnose a young baby. I'm here to give it more of a vocabulary for both parents and professionals to talk together, to collaborate. So your child has the opportunity of being more on track or consistent with their development versus not. No, everybody in my office, even when they have genetics and so forth, very little birth trauma, had no idea that this was going on. And I just want to change that.
What's powerful is that it doesn't just track if a baby is moving, it tells us how. Is the baby organizing gravity? Is rotation happening through the spine? Is weight shifting appropriately?
It is really something that way because again, I'm trying to really encompass, is the baby just ready for development and on track for development, not to wait to check the boxes of accomplishment. Remember, when I give you a test, it's because you already know the answers. So to take that and test a baby per se, you're expecting them to be able to do things. And that's what I'm trying to change is just that whole way of looking at babies and their movements and breaking it down so it is that simple. But for the most part, a parent won't even know that anything's going on. A mobile cart's going to come into the hospital room, just say, "Ma'am, can I have your baby, please?" And do what we call prone and supine, which means tummy in the back, and they will be videotaped, and also on the mat where they move on the mat. And then all that data is going to go into my artificial intelligence report is generated, one for the parents, one for the professionals, because professionals are going to get a different readout. And because I want enough evidence if that baby needs neurology, that it'll be enough to code to neurology, because people don't realize that you can't send a baby up to neurology on a hunch. And you see this on social media all the time. My baby might have CP. I'm not sure. And so because of that lack of communication, the child doesn't get sent up to neurology. And usually it's more drastic because a baby suddenly has had a seizure and this, that, and the other, but they get to a professional. And I'm trying to bind that gap so the MAC captures what's going on behind the scenes.
How long is the assessment?
I think I could have it down. Literally, it'll take more time to get the cart into the room and out of the room. It really should be a minute or less, but we'll have to see. Yeah, it will have to see what the final protocols will be, and it might obviously change because the hospital wants maybe longer documentation, which is possible. That's not a problem. But I can't see it taking more than 5 minutes.
Why do you think?
What is as far as that they would need more time? A lot of people are okay.
Minute or less.
Honestly, I can evaluate a video in 8 seconds, I think is all I need. Like I was golfing yesterday and you can see it on my post, and I posted it onto Movement Lesson for parents and practitioners as well. But my app does professional sports as well as, again, the math is the same. We're just looking at functional movement in the human body. And yeah, I just gave an 8 second video of my golf swing, and you can see where my balance shift is off, what I have to do for my torque differential. I mean, oh, it's pretty cool. That's just the AI. I'm not on the mat.
The data from the mat gives us a unique view into the body's movement potential. It's not just about did they roll or can they lift their head, it's about how their system is learning to move.
Oh, absolutely. The mat gives a really clear indication of a couple of things. So let's look at again. It's looking at the pre-functional movements, the stuff that builds foundation before the milestone actually happens. So first, just as a medical professional would determine breathing. Well, breathing is a movement. A newborn, let's say, with the potential of cerebral palsy or brain injury, tends to breathe very fast and short. Why? Because they're not truly lying down. Again, another movement, right? They don't have that ability for weight transfer. This is another measurable movement. Then they might have spasms or applied force. So one thing that you will never see in a typical baby or a low tone baby is again what people say is a startle or a spasm, right? Overactive Moro. I can go on and on with those conversations. But what it's actually doing is showing applied force. No baby should have applied force whatsoever to the mat or to the floor. And so, what my data that I hope to collect first is, let's say, if it's truly severe cerebral palsy, then maybe it has applied force indications of 26 per minute, let's just say. I don't know. I don't have all my data in. Let's say if it's moderate cerebral palsy, you're looking at applied force of 14 per minute. Or if it's mild cerebral palsy, let's say we've got maybe 8 or less per minute. So you're looking at applied force and you're taking in respiratory. So again, a high stress respiratory baby, or again, they're on cannulation and such, where they're doing that. You'll really see this in babies that are born addicted to drugs, methamphetamines. Their cry is not wah, wah. It's more like a machine gun. So you have these kind of again what they call indicators. I'm putting it all together so we can show across that globally this child's very high risk, needs to get sent to neurology for these reasons, just to get checked out, to be cleared. I'm not saying they have necessarily a neurological problem, but to get checked out. Whereas like a low tone baby that again is more genetics in nature, you'll see the breath labored as if they're trying to push their lungs off their body, right? You'll be able to show that the weight of the child filling the area into their lower back, because they almost look pear-shaped when they're lying down, right? It's a large warning where the lungs or the diaphragm area is actually wider than the shoulder and the pelvis. This is again what you see with hypotonic children. But again, we can show that that's an issue. Or let's say the baby has undetermined torticollis. I can show that there's a deviation of movement in the upper left quadrant by 16%. This baby should be checked for a brachial injury, maybe a broken shoulder, the collarbone that happens because of delivery, or torticollis. These, I'm trying to take the movements and make them measurable so professionals know where to go with a quicker eye, but also parents can say, hey, did you check my child for, so they're seeing it as well.
That's where we start to see risks, not just for motor delays, but for things like speech, feeding, even cognition. Because all of those functions ride on how the body organizes itself in space.
Yeah, the movement comes first. It does. The baby doesn't come out with language or communication skills. And that's another thing. Your baby's not talking to you in that way. So I mean, probably the hardest thing I ever heard from my son, if you've been following us, and if you haven't, oh my gosh, guys, we have great podcasts. Go. I know. Go listen to us. Go back. My son was very sick. My son's had 30 surgeries. Um, he had Haemophilus influenza, sepsis, preseptal. I can go on and on. But when he was finally able, he was around 7 and able to communicate more, because his goal at 4 was to say, Mom. My son was nonverbal. He went to Foundation for Blind. Again, not poor me, poor Graham, but this is just what happened to him. And I found out he had a stomach ache. And I said, and I was trying to explain to him like what an owie was, because that's hard to tell a child, where does it hurt? And they're like, what? What's hurt? And I was like, you need to tell me if something doesn't feel good. I need to know. And he looked at me and goes, Mom, I don't feel good anytime. And it broke my heart for 7 years. Like, I'm trying to do everything to help him, but this is normal for him. And so again, going back, woulda, coulda, shoulda, I can beat myself up, or I can solve the problem. Yeah. So
That's the beauty. When we see concerns at 2 or 3 months, We can start movement interventions that support the nervous system in real time, not after the window starts to close.
Well, not only that, but again, I'm trying to collaborate with professionals. At 2 to 3 months, I'm the first person that says doctors that way because again, I've been through it with my son. Um, I had more doctors on my phone call list than I did friends. Yeah. Right? You too. How many have you got through your life? So it's just at 2 to 3 months, people have to understand as a new parent, I'm not thinking, oh, should I take my kid to a gastroenterologist? But if you're able to read your baby earlier, not only are we working with development, but you're also working with the medical team possibly because they're not waiting for you. I get parents so stressed out. Oh, yeah, I don't see neurology to November. And I have to tell them, please call the office manager and see if you can say, ma'am, I'm 20 minutes from your office. I need an hour window. If there's any cancellation, I will be there. Or worst case, go to the emergency room, specifically ask for consult with that neurologist or gastroenterologist or whomever you want to see and to get on their now patient list and go from there. So by the time they realize maybe at 5 to 6 months, and this is what Kay and I have been trying to really educate on, and now you're going, oh gosh, I really need to see a gastroenterologist. At 6 months, do you have time now to wait till they're 9 months old, 10 months old? As I like to say, make the appointment or here with us with the motion sensor, get the evaluation now. Get your ducks in a row, understand it. And also, too, gosh forbid there's a regression or something happens to your child, like my son being so sick his whole life, right? You're on top of what they can be doing. Maybe they start not doing, like Kay's mentioning, the walker is getting a bit harder for her or such, and maybe do something about it and being proactive and just also having a vocabulary to talk to your doctors.
Actually, I only mainly use neurology and orthopedics rather than a dozen, but I'm not saying it offensively.
And also too, you're older, and because you can communicate and give your needs, you are working with the people that you need with. I don't need pulmonology anymore for my son, but we did probably 14 years of that. I don't need gastroenterology. I mean, we've might have, I wouldn't say aged out, but managed his care. But also too, I didn't get on medications that helped him for a long time. So now with IVIG and a couple of other key medications as well as, so I'm down to managing his care and getting him to do those things, to do all that. And so he goes to the gym more often. He's graduated, he does his th functions.
Same here.
Yeah. Your horseback riding, even if we just picked on your horseback riding, look at how well you're doing compared to when you first started. But that's like anybody. The babies aren't driving a car when they're 2 months old. It takes a long time to mature a human body.
The infant sensor mat gives us information we just didn't have before. It helps parents understand their baby and helps professionals customize support based on actual movement patterns, not guesswork.
And most of all, it's for that child in particular. It's for your baby. It's for your child. It's for your movements. We're not here to generalize and say, well, the chances of you this or by this eventually, and that's why I don't go by government standards for milestones. I'm not waiting for the hope so. I want a clear and consistent game plan. And so for a parent that just says, I just had a new baby, what do I work on? Well, let's go for tummy time. This is where your child should be at. And then you can say, I'm not sure if this tummy time looks good. Let's get the child evaluated to make sure there's no movement deviations. Because again, we're not here to fault a child, but things happen like maybe hip dysplasia, worst case scenario, or things like that. That could be into play. And it's just having a game plan. It's like going to school and getting a semester, or what are your courses for the year? We do it for almost every, like where you join soccer, or like you're getting ready for certain dressage recitals. You have a schedule. Well, we should have one for babies.
Or just evaluating my wheelchair Friday.
Right. You have a schedule, and again, Kay and I discussed this. Her wheelchair is she's outlasted the wheelchair. But guys, also too, this is a whole nother subject. We get cars quicker than Kay's been given an upgrade on her wheelchair. And so she has to assess her body and how she moves off of a system that says, well, she can go 10 years in a wheelchair and not need a new one. And factors need to be taken into account that maybe she does need something sooner that she's more comfortable in and is more agile.
I don't necessarily need one, but I don't know.
This is the whole point why we the infant motion sensor. You don't know when you haven't been evaluated. Yeah. So, yes, you might not need one for another 10 years. I'm about assessment. I'm
Yeah.
about being proactive. And that's what, and again, we're doing it for you. We should be doing it for all babies.
This has been such a rich conversation, and Michelle, I love that we got to share the heart behind this tool you created.
I can't thank you enough. Kay and I were just talking about we are coming into working together for over the past year. But at the same time too, I don't do barely anything with Kay. Kay podcasts that she has available in her rich content, and what she's trying to bring for and I admire her for because she's not a parent yet, but for parents and professionals and for children, the advocacy of just knowledge is so admired.
Right back at you.
Thanks. But I really want to stress again, the infant motion sensor mat is not out yet. However, I have it here in my clinic. You're more than welcome to come in for that and for what I do for movement lesson. I also do free assessments on my group movement lesson for parents and practitioners. But I also have already established a movement lesson.academy. If you want at least your video read by my artificial intelligence to get a report, that's available as well. I think it's really important that again, knowledge is power, and how you present yourself to your professional is also just as powerful. And professionals need to understand what parents are going through.
Yeah.